Cardiac rhabdomyoma in adults. Background: tuberous sclerosis complex is an autosomal dominant genetic syndrome associated with multi organ involvement, including cardiac rhabdomyomas. Case presentation: a 34-year-old lady with tuberous sclerosis complex was referred to the cardiology clinic for screening. She denied chest pain, dyspnea, or syncope. Vital signs and cardiopulmonary examination were normal. Dermatological exam revealed multiple angiofibromas on the face and the fingers. ECG revealed normal sinus rhythm. Echocardiogram revealed a 3.7 cm times 1.9 cm echo-dense mass attached to the lateral wall of the left ventricle, consistent with rhabdomyoma, as we see here in figure 1 and figure 2. Figure 1 and figure 2 shows the rhabdomyoma arising from the lateral wall of the left ventricle and protruding into the left ventricular cavity. The left ventricular systolic function was preserved. Holter monitor did not reveal abnormal rhythm. She was recommended surveillance with yearly ECG and echocardiogram. Discussion: rhabdomyoma is usually diagnosed in infants, 70 to 90% of whom have tuberous sclerosis complex. However, tuberous sclerosis complex associated cardiac rhabdomyoma commonly regresses spontaneously within the first 2 years of life, thus being extremely rare in adults. Every patient diagnosed with tuberous sclerosis complex should be screened for cardiac rhabdomyoma because even though usually asymptomatic, it can cause inflow or outflow tract obstruction and aberrant conduction leading to heart failure and arrhythmia respectively. The American Heart Association recommends surveillance with ECG every 3 to 5 years in asymptomatic adults to monitor for abnormal rhythm. However, surveillance regimen should be tailored to patients depending on the tumor size and location. Conclusion: cardiac rhabdomyoma is extremely rare in adults. However, adults diagnosed with tuberous sclerosis complex should undergo appropriate cardiac screening and surveillance because of the associated risk of heart failure and arrhythmia, the latter being potentially lethal.